What is love addiction? Everyone should have the opportunity to experience the bliss that comes with falling in love at least once in their lives. Nearly everyone yearns for a loving mate who can reciprocate their feelings for them. However, love may sometimes take on forms that are harmful, and some people are susceptible to being persuaded to behave in unusual and unexplainable ways, which may put them in danger as well as the people they care about. And when that happens, it becomes an addiction. Love addiction. A person who is suffering from love addiction will exhibit symptoms like unhealthy and obsessive concentration on their romantic relationship. They will also find it difficult to form and maintain relationships that are fulfilling. Love addiction may develop in any kind of relationship, even those that aren't romantic. This is something that could happen between friends, or between children and parents, or even between strangers. However, romantic relationships are the most common setting in which it occurs. People who suffer from this condition often have unrealistic expectations on the qualities that should be present in a satisfying love relationship. If these conditions are not met, it will only serve to make their position much more difficult. Because of this, they end up developing unhealthy obsessions and trying to exercise abnormal levels of control over their partners. Irrational conduct and strong desires are two of the hallmarks of addictions in general, and these characteristics are also present in persons who are addicted to love. People may, however, unlearn their negative ideas and behaviors regarding romantic relationships and learn how to form healthy and rewarding interactions with other people if they have access to the appropriate assistance. Love addiction symptoms. The effects of love addiction will seem to be slightly distinct for everyone. An unhealthy concern with the other person is the most visible indicator of love addiction. This unhealthy preoccupation presents itself in obsessive behaviors such as excessive contact or even surveillance of the other person. The following are common signs of an addiction to love. Number one, the feeling of emptiness or upheaval of being single, or despair when you don't have a significant other or aren't in a relationship. Number two, a preoccupation with one's partner's needs and feelings. Number three, emphasizing your romantic connection to one another to the exclusion of all others in your life, even to the point of ignoring your responsibilities to other people you care about. Number four, depression and obsession sets in when sexual attempts aren't returned. Number five, always looking for love, even when you know the person isn't good for you. Number six, struggling to break out of destructive relationships. Number seven, acting irrationally because of how you feel about your loved one. For example, quitting your job or cutting ties with your family. And number eight, having thoughts about one's relationship or love interest that are so intrusive that they cause problems in one's daily existence. There are a great number of other indicators of love addiction, some of which may not have been listed here. This is because there is a diverse array of symptoms related with the disease, as well as the fact that every individual has their own one of a kind method of expressing their emotions. The way a person expresses their feelings has a direct bearing on the symptoms that person suffers. The severity of love addiction symptoms might also differ from person to person. Some warning signs, such as making numerous phone calls, may seem harmless, while others, such as stalking someone who is romantically interested in them or restricting their social connections, may be highly harmful. Techniques for detecting love addiction. The term love addiction is not included in the list of recognized mental illnesses in the Diagnostic and Statistical Manual of Mental Disorders 5. The classification of this condition as a mental disease has been the subject of much debate among many individuals. Because of this, diagnosis is more difficult than it is for other mental health conditions that are more well known. Have a conversation with your doctor if you or a member of your family is worried about the possibility of love addiction. If they believe that a love addiction is a helpful way to conceptualize your problems, they will most likely recommend that you see a psychotherapist who will conduct several tests and ask you a series of questions in order to make their determination. The Love Addiction Inventory is a tool that was developed in the year 2019 by specialists in the field of love addiction in order to assist in the diagnostic process. The purpose of this questionnaire is to assist medical professionals in making a diagnosis of love addiction. Why do people get hooked on love? More researches are necessary in order to get a comprehensive understanding of love addiction and to be able to clearly identify its roots and triggers. There is some evidence to suggest that traumatic experiences and genetics are two of the numerous factors that might put a person at risk for developing an addiction to love. It has been hypothesized that the euphoric sensation one receives when they are in love is comparable to the pleasure one could get while misusing narcotics such as alcohol or cocaine. The researchers saw behavioral parallels between those who were in romantic relationships and others who had problems with substance misuse. People in either group may have symptoms like emotional dependency, cravings, mood swings, compulsions, obsessions, and a lack of self-control. When you are in love, certain chemicals in your brain, like dopamine, are produced, which helps you appreciate it more. The behaviors associated with substance abuse and dependence are almost identical. Some more frequent causes of compulsive romantic behavior are 1. Having to face up to abandonment problems from your past. 2. Having low self-esteem. 3. For those who have experienced past emotional or sexual abuse. 4. Having gone through a harrowing romantic relationship. And 5. Experiencing a traumatic event as a youngster. Counseling for love addiction. The treatment of addictions that are fueled by love sentiments is notoriously challenging. Because it is not an officially recognized mental disease, your doctor or therapist has some freedom in choosing whether you have it or not, and how to treat you if they conclude that you do. The reason for this is because it is not an officially recognized mental illness. It is feasible to treat addiction to love in the same manner that one would treat addiction to any other substance. To determine whether psychotherapy is effective in the treatment of love addiction, further research is required. Since love addiction is not recognized as a genuine mental illness, there are no medications on the market that are specifically designed to treat it. Your physician may offer medication to assist with the symptoms of a co-occurring condition, such as anxiety or depression. You may discuss this possibility with your healthcare provider. According to the results of a limited but promising body of research, the use of medications such as antidepressants and mood stabilizers has been demonstrated to benefit some individuals with love addiction in coping with the obsession and impulsivity that are characteristic of the illness. Struggling with romantic addiction and its consequences. Admitting that you have a problem is one of the hardest parts of dealing with love addiction. Love addicts often lack the insight to see why their preoccupation with romantic relationships is a problem. Seek medical help immediately if you believe you may be experiencing love addiction. You may learn more positive methods of showing affection with therapy and care. If you have a love addiction, here are some recommendations to help you manage with your illness while you seek therapy. Number 1. If you're not dating someone at the time of your diagnosis, you should learn to be comfortable being alone. Before getting into a new relationship, it's a good idea to figure out what led you down the path of addiction and make some headway in your recovery. Number 2. Keep an eye out for patterns. A love addict will likely repeat the same actions with each new partner. Consider your love history and seek for trends. Number 3. The best approach to fall in love with yourself is to put time and energy into improving yourself. Individuals suffering from love addiction often put the needs of others above their own. Number 4. Lean on the people you love and trust. Discussing your situation with those who care about you may assist. And number 5. One of the most reassuring aspects of dealing with any illness is learning that you are not alone and that others have experienced similar things. You may meet folks like this by joining a support group. You may also get in touch with folks who have successfully treated their ailment.